Finally getting around to this because you folks have been busy for much of the morning, right? This is the fine folks at the Parkinson's Research Unit at the Hawaii Pacific Neuroscience, gold sponsors, and every time we've tried to come up with you and talk to you today, there's been a line or there's been some people talking to you. Who's going to do the talking here? Is it okay? All right. Well, tell me your name and we'll chit-chat.
Okay, my name is Eric. I'm a clinical research coordinator at Hawaii Pacific Neuroscience. And most of the studies that I'm involved with are movement disorder. So that's why I'm here today, hopefully to spread the word about opportunities for folks with Parkinson's who would like to contribute to the medical knowledge base and also perhaps find some medication that can improve their daily life.
Jerry was mentioning something about like some trials that are going on, or are you the ones who are involved in that?
That's right. Yeah, we have several clinical trials available for folks with Parkinson's. Just depends on, I guess, the demographic you're in and which trial you qualify. So the sponsor's looking for a certain type of patient, and based on our providers' opinions and based on the assessments that we perform at the clinic, you will likely fall into one of the trials.
All right, Eric, thanks very much. What's a good way to get more information, especially for those who aren't able to be here with us today in person?
You can always contact us at 808-564-6141. That's the direct line to research. You can speak to myself or any of my coworkers who are equally as knowledgeable. You can also email at info@hawaiineuroscience.com.
All right, info@hawaiineuroscience.com. All right, Eric, thanks very much for your work as well. Let's head to Abbott. She's she's been there. How you doing? Good, good. All right. Well, Abbott, you're one of the sponsors as well. Tell us what you do, and well, first off, what's your name, and then tell us what you do.
Sure. I'm Shannon Yeager. I work with Abbott DBS, so deep brain stimulation, which is your device for Parkinson's disease management. For those of you that are or are not familiar with DBS, this is a great adjunctive therapy that physicians will suggest as your disease is progressing. So when you start to see medications wearing off or not lasting as long, you have tremor, stiffness, slowness, dyskinesias, that medications aren't typically always helping, or you're taking too many medicines, that's kind of the good time to start having that conversation with your doctor about deep brain stimulation. I work a bunch with the folks over at Queens and at Kaiser as well, and it's just a great therapy for patients with Parkinson's.
All right, and if anyone wants more information, once again, especially for those those people who are joining us online, tell us what's the best way to do that.
Sure. AbbottDBS.com is probably the best way to get a hold of different patient education videos, get in touch with a patient advocate, and learn about the product and what DBS can do for Parkinson's.
All right, thanks so much. I was just interested in what is this?
So this is the electrode that is implanted into the motor cortex of the brain that sends little electrical pulses into the brain that allows for the patient's symptoms such as tremor, slowness, stiffness to be subsided by reintroducing the proper functioning of the neurons.
All right, obviously more information once again over at Abbott. One more time with the website.
AbbottDBS.com.
Got it. Thanks very much for your time. All right, Reggie, we are going to let's go to Acadia because we've been going around. Hey, tell us who you are and what you do.
Yeah, my name is Tom Starr. I'm representing Acadia, a company out of San Diego. And we focus on symptoms, non-movement symptoms of Parkinson's disease. In fact, in some cases, these can be very detrimental if not aware of. And so particularly, we focus on hallucinations and delusions associated with Parkinson's disease.
Yeah, because I've heard of those cases where a lot of people, when they think of Parkinson's, they just think of the tremors and so forth, but there are other things going on.
That's correct. Basically, people look at movement, and that's what they think about. But the reality is, part of the disease sometimes is hallucinations and delusions. Now, sometimes the doctor will let you know that sometimes those are based on other medications, but they can also be based on the disease. And it's important to talk about it. I think there's been a stigma for a long time. If you have a hallucination, delusions, you're going crazy or whatever. But we want people to know you're not going crazy. It's part of the disease, and it's something that you want to bring out in the open. It's not something to hide. And as you do, there's a lot of people, resources, and your physician that can help you. And there's treatment for it as well.
All right, best way to find out more information, especially for those who aren't here in person.
Yeah, nuplazid.com is where you'll want to go, and particularly your healthcare provider. That's probably the best place. Nuplazid.com and your healthcare provider.
All right, thanks very much for being here today.
Thank you.
All right. Hello and welcome back to the symposium for the Hawaii Parkinson Association. Once again, I'm Ben Gutierrez, and we're ready for our final presentation. A lot of you have been giving us comments and questions online who are joining us on Zoom and YouTube. And we also had a lot of people, as you saw in the last segment, we went around with a lot of the different breakout rooms. Right now, I'm going to turn things back over to Jerry Boster because we've got some interesting developments and the latest in the research. So, Jerry, take it away.
So for me, it's my pleasure to introduce two of our very special doctors that we work with here in Hawaii. First one is Dr. Webster Ross, who I think most of you are probably familiar with him that have been around for a while, because he does our research update pretty much every year. He was my neurologist for 8 years, and we've had, I also consider Webb one of my mentors for a lot of the stuff we're doing in Hawaii. And so it's my great pleasure to introduce him. And then with him is Dr. Michiko Bruno from the Queens Parkinson Movement Disorder Center, the director there. And I detailed earlier a lot of the things that we're doing there. And Queens is, besides doing a lot of the treatment, is starting to look at a lot more of the research aspects. And so this was a kind of natural where we bring two of our best from the community to give us what is the latest and greatest stuff that I haven't already talked about. And there is actually, it's amazing how much is going on out there in the research world. Michael J. Fox is doing about $300 million a year in private funding. And then one of the founders of Google, his wife unfortunately passed from Parkinson's, is adding another $200 million a year. So we're up over $500 million a year in Parkinson's research right now. And that's just the private side. There's money coming out of NIH. But I'll leave all those good details of what's actually going on to Dr. Ross and Dr. Bruno. I'll turn it over to them. Thanks for being here, docs.
Well, it's really a pleasure for us to be here today, and I want to thank Jerry and Hawaii Parkinson Association for inviting us. And this is just another great event in a series of great events that get better every year. Thank you for this wonderful venue. Thank you for the great presentations and for all the vendors providing good information. So we're going to spend about the next 40 minutes talking a little bit about research, and obviously we're not even going to scratch the surface. There's so much going on in research in Parkinson's disease. And just as an example, if you go on to clinicaltrials.gov, which is a website that reviews clinical trials that of all kinds, and you just do a search on Parkinson's disease, there are over 100 clinical trials that are involved with treating some component of Parkinson's disease. And I just think that that's really has to make us all feel optimistic and good about the future of this condition. So just as a way of getting started, we're going to talk a little bit about some of the basic science advances and mechanisms. And so I'll ask Dr. Bruno to kind of share what she thinks are some of the more important advances in mechanisms recently.
Yes, thank you so much for having me. This is such an exciting event every year, and I really appreciate everybody coming and joining, including the sponsors and the Hawaii Parkinson Association, volunteers, and participants, because I think participation in these kind of event is extremely important. And I know people are very interested in the latest science research, what's there. but it's all tied to participation in community in my mind, because more and more there are research showing that brain health, not just focusing on Parkinson per se, but overall brain health really impacts the state of Parkinson's disease, and maybe it's related to etiology. So some of the studies that I was very interested was relationship with the gut health, which actually Dr. Ross pioneered even before we knew this was. Now it's sort of accepted that gut is related to brain, which when I was in medical school, I would think it's completely separate organ, but now there is a lot of research on gut health that affects brain health. So that was one of the more interesting development, as well as things like sleep. We don't 100% understand the function of sleep, but sleep may have cleaning effect. We sleep to rest, but also clean up the toxic buildup of some of the proteins that might be associated with Parkinson's or other neurodegenerative disease. So it may be all related, as well as, of course, exercise and diet. So we wanted to be a little more conversational on this topic, and I learned so much just talking to Dr. Ross and bouncing up different questions. So what do you think about the gut health that you pioneered?
I think that there is a lot of interesting things going on in regards to the gut and Parkinson's disease, and looking at different effects of different kinds of bacteria in the gut that might help Parkinson's disease and others that might hinder it. And so I think that really ties into nutrition in Parkinson's disease, and thanks to Jerry and Janice, by the way, for preparing a very nice, healthy snack while they were demonstrating how to chop. But I think that it raises issues about nutrition in Parkinson's disease, and how nutrition may favorably affect the normal bacteria in our gut that helps to digest food and to move food along the tract. And you know, one of the things about Parkinson's disease is that the symptoms, the slowness, and the trouble swallowing and the tremor, all of these things interfere with ability to eat and to have a good diet, because it's just very difficult to eat. And so as many as 3 to 60%, depending on how you define it, of individuals with Parkinson's disease are actually malnourished, and it's because of this difficulty eating. And we also know that when you're malnourished with Parkinson's disease, the symptoms are much worse. So it's a positive feedback loop. You know, the worse your symptoms are, the worse your diet is, and the worse you're able to eat, the worse the symptoms get. So we're always looking for ways to improve nutrition. And one of those, I think, is a diet called a protein sparing diet or redistribution diet. And this is kind of important because we know that proteins can interfere with the absorption of carbidopa levodopa, which was the mainstays of treatment for Parkinson's disease. And by actually deferring the amount of protein until the evening, you can increase the amount of absorption for levodopa and increase the effectiveness of the medication, and still maintain a good, healthy diet with protein. So that's one thing. Did you have anything to add to that?
No, but I think this is a great segue to the next section, where it's tied into a preventative approach. I think we all want to know how to slow down the process. So is diet or any other lifestyle intervention shown to help slow the progression?
There are several diets right now that are being investigated in Parkinson's disease, and lifestyle intervention, I think, is one of the more exciting things about research in Parkinson's disease, because it's something that we can do now, and we don't actually need, the facts. We can do it now before the trials even prove it, because we know it's healthy and we know that it's safe. So you're all probably familiar with the Mediterranean diet, and this is a diet that's very high in leafy vegetables and in fruits and in beans and fish, and a moderate amount of alcohol, and really backing off on our consumption of red meat and dairy products. And this diet actually, in observational studies of Parkinson's disease, individuals who have been able to adhere to this type of diet actually have a lower risk of developing Parkinson's disease. And in fact, it's also been shown that people who adhere to this diet have a lower risk of developing some of those very early non-motor symptoms of Parkinson's disease. You know, we now know that things like impaired olfaction, constipation, excessive daytime sleepiness, and other non-motor symptoms actually can predate Parkinson's disease by several years. And there have been studies that have been able to show that adherence to this Mediterranean-style diet have a lower risk of developing even these earliest symptoms of Parkinson's disease, these prodromal features, we call them. So I think that that's really, really exciting.
What about, it seems like I'm just asking questions at this point, but what about a relationship between diabetes? There's a study that came out, shows that diabetes patients with Parkinson, maybe the disease progresses a little bit faster, maybe the medication for diabetes can potentially be helpful. And I wanted to also separate that there are, in Parkinson trials, there are trials to try to slow down the process, separate from medication or intervention or surgery to try to help the symptoms. So I'm talking about slowing down the process, neuroprotective. Do you mind talking a little bit about the medication intervention?
Sure. So, you know, I think the diabetes is a great example. We know from, again, from observational studies, that is, studies where they can look at these very large databases and they can identify everybody with diabetes and see what medications they're taking, and then also see, you know, who develops Parkinson's disease. And in fact, individuals on certain medications used to treat diabetes seem to have a lower risk of developing Parkinson's disease. And one of these is exenatide. It's a commonly used medication for the treatment of diabetes, and it's been shown in these studies to be associated with a lower risk of developing Parkinson's disease and actually slowing down the progression of Parkinson's disease. And in basic science studies, it's been shown to be a very potent antioxidant. And you remember that this oxidation process is thought to be one of the processes that underlie the cell death in Parkinson's disease, that injures and eventually damages and kills, destroys those cells in the brain that produce dopamine that lead to normal movements. So it's possible this exenatide is actually an anti-oxidation where it's helping to get rid of these oxidants. And it's also an anti-inflammatory agent. And we know that inflammation is really ramped up in the brains of people with Parkinson's disease. And the exenatide seems to be able to decrease that inflammation. And so last year, when I gave this talk, I presented some early data of a phase 2 trial. And you remember, when you think about clinical trials, the earliest phases, or phase 1, are trials that are done on normal people to test the safety of a new medication. Phase 2 usually are involve the patients that you're interested in, the patient population. But they are also looking at safety and dose finding. And then the definitive trials, the phase 3 trials, are the efficacy trials, where they're really designed to answer the question, does this medication work for the disease that we're talking about? And so last year I reported on some very encouraging results from a phase 2 trial of exenatide. And I'm happy to say that now there are, I think, at least three phase 3 trials that are going to end within the next 1 to 2 years that should answer definitively whether or not this medication may actually slow down the progression of Parkinson's disease. And I think that this is really exciting. And so exenatide is just really one example of medications that that we call repurposed. That is, they were approved for a specific kind of an indication for a disease, but we found through basic science studies and through observational studies that they may be beneficial for slowing the progression of Parkinson's disease. And another one of these is a medication called albuterol, and this is really recent research. And albuterol is actually used for asthma. And actually, we've been able to show that individuals who take albuterol for asthma or chronic obstructive pulmonary disease or whatever the reason, have a lower risk of developing Parkinson's disease. And I think that we're going to see trials in the future. And then one other, before I give it up here, that I think is a really interesting medication is Embroxol. And there's a clinical trial now going on in Canada, I think in the UK. Embroxol is a cough medicine. It's a simple cough medicine. But it is also a medicine that beefs up the activity of an enzyme called glucocerebrosidase. And we know that there's a gene that produces glucocerebrosidase, mutations of which in this gene lead to an increased risk of Parkinson's disease. And it seems that this glucocerebrosidase is involved with getting rid of the toxic synuclein that Dr. Bruno was referring to a little while ago, and getting it out of our system. So people with Parkinson's disease tend to have lower levels of this, even those without the mutation necessarily. And it's thought by beefing this up, we might be able to increase the clearance of these toxic proteins. So I think that this is another exciting repurposed medication for disease modification.
Yes, so there's a lot of exciting thing on the horizon in terms of trying to prevent or at least slow down the progression. But I guess understanding why this process is happening is extremely important. So is there progress in that? And I think we do want to report a negative study as well, because this was big on the news about doing like immunotherapy for the alpha-synuclein. So again, I'm going to throw it to Dr. Ross because he's the expert on this. But
so immunotherapy, I think is it's being used in many what we call neurodegenerative conditions, Parkinson's disease and Alzheimer's disease. And so by immunotherapy, we mean one of two different kinds of things. We need giving an individual antibodies that would fight against whatever it is you're trying to fight, or a vaccine. Of course, we're all familiar with vaccines these days, and vaccines actually encourage our body to produce antibodies against whatever it is we're trying to ward off. So in Parkinson's disease, we think that the offending protein is alpha-synuclein. Alpha-synuclein is this protein, and we don't fully understand what alpha-synuclein does. We don't fully understand how it comes to be abnormally deposited in the brain cells of people with Parkinson's disease, but for some reason, this protein forms clumps in the nerve cells that are degenerating and dying. And we don't fully understand this process, but we think that by eliminating these clumps of protein, we might be able to slow down the progression or even halt the progression of Parkinson's disease. And there's been some really promising work in animal models using this immunotherapy. Last year, I reported on one trial that didn't show a lot of promise, but it was a phase 2. It did show that the medication was safe and tolerated very well among people with Parkinson's disease. So that has spurred another clinical trial of this compound, which we hope will end this year, and we'll know a little bit more. Unfortunately, of the 5 of these compounds that have been tested and developed so far, 3 of them have just failed, and continued work on them has been discontinued. 2 of them are still being studied, and so we'll hope that we see positive results on those clinical trials. And then on the vaccine front, there has been, to my knowledge, one study, and this was again an earlier phase study. And the interesting thing about this study was it wasn't just looking at the progression of Parkinson's disease, but it was looking at the effect of the vaccine on levels of this clumped protein, in the brain. And so an early trial has shown that there's a trend, at least, toward these clumps being decreased in the people who got the vaccine. The vaccine was well tolerated. There was not any difference in the symptoms of Parkinson's disease or the rate of progression, but I think, so obviously work still needs to be done in that area.
Yeah, so that was a lot of information, but just to summarize, I think understanding how Parkinson happens and progress really helps design these trials. And there's a lot of trials that is going on right now, which is great for all of our patients and families. But the research progress does take time, and we learn from trials that are negative to improve the next trial, and it's an incremental progress. So some of the newer thing is the exenatide, but you can even start eating healthier, and that could directly translate. That's something you can do today, as well as other medication that's being used for other medical condition, which speeds up the trial. So it's a very exciting time. So moving on to symptom treatment. So we were talking about progression. Now we're going to talk about symptom. So maybe I'll just start with what I'm excited about the symptoms. Majority of the treatment for symptom is manipulating or trying to balance the chemicals in the brain. And the biggest example, of course, is dopamine. But it's not just dopamine. There are attempts to change the level of different chemicals. So in terms of of course, we all know that levodopa is one of the mainstay, but over time, levodopa is not as reliable. You may experience up and down. So how do we stabilize it? And that's kind of the million-dollar question. We already have some ways to try to help that, including like Duopa, which is a jejunal infusion of dopamine liquids to stabilize. But one of the things that I'm really excited and hopeful is a subcutaneous version of the apomorphine as well as levodopa, which is like an insulin pump. You can just put it in your skin and kind of stabilize. So the phase 3 study was done last year, and I think we might have talked about this. It's currently under review by FDA. So we'll see how this goes, and we're waiting to hear from FDA. And then there are other compounds that's been studied. There's a lot of new approval of medication, which we hear about in news. There are a lot of them are repurposed or kind of a slight change in the old version. So a little tweak, nothing like dramatic, no game changer, but the attempt is to stabilize the dopamine level using different techniques. Is there anything that you're excited about in terms of motor control?
There is a device that I think is kind of exciting, and this just raises the issue for me One of the things that keeps me interested in research and keeps me on my toes are you folks. You know, my patients come to me and they say, what do you think about this? And a lot of times I don't even know what they're talking about. So I have to go to the literature and, you know, study up on it and look at it. And it challenges me and it keeps me on my toes and it just, you know, it informs me about what's happening. So one of these is a type of glove that produces vibratory sensation in the fingers, vibrotactile stimulation. And the idea is that these stimulations sort of reset abnormal brain oscillations that occur in people with Parkinson's disease. So you might think, well, this just sounds like a bunch of hooey, you know, a glove like this. But actually, if you go back to some of the earliest treatments of Parkinson's disease, there was a very famous neurologist in France at the end of the 19th century, in the late 1800s, named Charcot. And Charcot was a very astute observer of people with Parkinson's disease. And he noticed that when they came back from a trip, from a long carriage ride, or from a long train trip, after, you know, sitting and bouncing around for a while, their Parkinson's disease would be better. So he actually designed a chair, a vibration chair, and used that as a treatment for Parkinson's disease. And I don't really know how that turned out, but actually it's kind of stayed here and there in the literature. And there's a very bright neuroscientist at Stanford who came up with this idea of vibrotactile stimulation in the form of a glove. And the individual with Parkinson's disease wears this glove for several hours a day, and it really does help with the motor and even some of the non-motor symptoms, mainly the motor symptoms of Parkinson's disease. It is a symptomatic treatment. And there have been 3 trials of this, and part of the issue, of course, with clinical trials is there's always a placebo effect. That is, you know, the idea that something will help, just the idea that something will help makes it help. And that's why all of these trials that we do usually have a control arm that's the inactive medication or a different medication to contrast with the study medication. So none of these trials with the glove have been controlled trials, and so but they've all been successful and seem to show benefit in symptoms. So now there is a clinical trial. It's a single study, a single center study being done at Stanford with this glove, and it has a sham comparison group. So I'll be anxious to see what happens with that in the future.
I wanted to echo something that Dr. Ross just said. I think for us, the reason we're both physicians but also interested in research is exactly that. We directly want to treat you, hear from you, and observe things and want to improve things. So I think it's a really great partnership with treatment and research that both needs to be done, and we really want to hear your thoughts, and we also want to observe what's going on. So the stories that you tell us are so extremely important, and that motivate us to want to do research or find out about other people's research. So the Stanford glove is, yes, exactly. A lot of patients has asked me about that, and unfortunately it's not like available today, but hopefully the research will show some improvements so we can report back to you that we can start using it in a few years. In the meantime, this is slightly, this is going to be in use actually, is MR guided focused ultrasound, which is a technique to try to zap the brain, if you will. I feel like I'm using a much less scientific term than Dr. Ross, but anyway, you go into the MRI machine and ablate the part of the brain called thalamus, which is contributing to the tremor. And this is not a cure. This is just a pinpoint treatment to control your tremor. But it will be available at Queens, this is a little plug, in January. So we're hoping that will help at least the tremor. It's not going to cure the overall situation, but we're excited about that. And it's a new technology So hopefully maybe we'll understand how the brain works better, and it will be applied to more different symptoms. But this is also a same line of treatment as deep brain stimulation, which is understanding how the brain circuit works and trying to improve the function by altering the circuit. So I think the future of brain DBS, which we have been doing for a long time as well and accumulated more knowledge, is that it will be more adaptable. Right now we just stimulate, but in the future we'll get more information from the brain and adjust the stimulation according to what the patient's brain is doing, so we can be more efficient and lessen the side effects. So there's a lot of neurophysiology research going on that we're very excited about. Some of the, there's different company that makes DBS, but some of the company were able to control and adjust the program even remotely through internet. So again, the advance in technology is helping us reduce the convenience, increase the convenience, sorry. Make it more convenient and lessen the side effect and improve efficiency. So again, research is incremental, but it is improving things every day. Any other symptomatic treatment that you wanted to talk about?
I think people would be really interested to hear the work that you're doing right now as well.
Yes, so let's talk about local research. There's a few local research effort going on. You can always go to clinicaltrials.gov that Dr. Ross was talking about, as well as Michael J. Fox Trial Finder. But we also want to do research that's tailored to the community that's here. And Dr. Ross is actually our mentor on this research, so we're collaborating. The research that we are doing is directly related to our desire to understand the needs of the community and the access. I think a lot of people here are involved in which is great, but we want to increase the reach. We want to understand if there is a difference in demographic characters, comorbidities, meaning other medical condition, how different race, where we are very fortunate to have diverse group of people, how different people have different clinical types, or is it environment? So kind of understanding what's going on in Hawaii exactly in this community, because majority of the research are done to try to understand Parkinson is done in white population in North America and Europe. So we want to research our people honestly, and we're starting a pilot as well as reviewing some of the hospital data which is already available. So we can look at the hospitalization data retrospectively, but we're also collecting information on patients with Parkinson's disease in Hawaii to just ask about really basic things like medication, their medical history, their access, their journey, their quality of life, their attitudes to research, what is the barrier if we were to conduct research. So yes, so this is the research that we're doing. And sorry, I'm talking a lot because I'm so passionate about this topic. But one of the things we found already in the retrospective portion is that different race, ethnic groups may have different manifestation profile, and so the Native Hawaiian, Pacific Islander, as well as Filipino population may be a little bit younger, as well as they have more comorbidities, including diabetes that we talked about. So it's not just the Parkinson in isolation, the other health things matter. Access matter. We don't really know why, but people who had diabetes, as well as renal disease and other comorbidities, fared slightly worse. So it's incredibly important to be healthy and work on diet and exercise. And again, I don't have a conclusion. One of the best research produce more questions than answers, but it's starting to shape up this new view that all the health things matter to the brain. sorry, I talked too much, but do you have comments on this?
Yeah, I just want to say it's just been a pleasure working with Dr. Bruno and her group on this project, and I think it's really an important project. It's going to give us a lot of clues about different manifestations of and symptoms of Parkinson's and response to medications and different aspects of treatment and access to care. So it's going to be exciting to see the results of this as they unfold in the next few years. And I just want to thank Dr. Bruno for inviting me to be a part of it. One thing that she mentioned that I think is worth sort of emphasizing are lifestyle interventions for treating Parkinson's disease and possibly even for slowing down the progression. And one of these, of course, we talked about is diet. But another one where there's actually more evidence for slowing progression than diet is exercise. And through the years we've talked about exercise as an important intervention. And we've had great talks from Jimmy Choi and others about the importance of exercise and how it's helped their symptoms of Parkinson's disease. And there's lots of evidence that it seems to actually people who exercise, if they get Parkinson's disease, it's a later age at onset, and it may even prevent Parkinson's disease from occurring. And I think it's worth spending a little bit of time. There are two recent trials that I'm really encouraged about. And one of these trials used treadmill intervention. People were randomized to treadmill intervention or usual care, and they were followed for 6 months, and it was pretty intensive exercise. And actually, those that were in the intervention in the treadmill had stabilization of their motor symptoms to a greater degree than those who were in the usual care, suggesting that exercise maybe slows down the progression. And then another one actually used a stationary bike as the intervention. And the really neat thing about this stationary bike was it used gaming software to make it much more interesting for the participant, and made it a little bit competitive. And there's actually animal evidence that learning while you're exercising actually is even better than exercise alone. So that's one of the things that attracts me about these gaming interventions and cycling. And so again, these folks were followed for 6 months, and the group that was randomized to the gaming actually had a slower progression or stabilization of their symptoms greater than the usual care, again suggesting exercise can slow progression. The other really neat thing about this trial was that they did imaging, and they were able to use a different endpoint than just progression of symptoms. And that endpoint was brain function. They used functional magnetic resonance imaging to look at brain function. And they were able to show that those who were in the exercise arm, the bicycle, actually had better brain function at the end of the trial than those who were randomized to usual treatment alone. And there was less brain atrophy. And this is only over 6 months. So I think, again, this is great evidence that exercise is effective for symptoms and possibly for prevention and possibly for slowing progression. So one last thing I want to say, though, is if you want to exercise, be sure to meet with your primary care provider and go over how to start an exercise program with them, so that you don't. The only problem with exercise is falling and injuring yourself and that sort of thing. So you want to avoid that.
Yeah, thank you so much. I think the Hawaii Parkinson Association over the course of the years have really advocated exercise. They have grouped a lot of different programs. But last, we also wanted to talk about one other local trial that's going on. I think Jerry might be, I guess, sorry.
Jerry mentioned this before, and I'm sure he doesn't mind my mentioning it again. I think the name of the medication is pronounced buntanetap, but I could be wrong about that. But this is a really interesting medication. It's a small molecule that decreases the production of some of these toxic proteins. And the thing that's so interesting about this medication is it's nonspecific. It seems to be nonspecific. So it not only decreases the production of alpha-synuclein, which is we know in Parkinson's disease, but also amyloid and some of the other proteins that are involved with Alzheimer's disease and dementia. So in an early trial of this medication, it actually was shown to be very well tolerated, and it showed a stabilization of motor symptoms. And so this has led now to this phase 3 that Jerry is a part of, and Hawaii Pacific Neuroscience is now enrolling. And I'd encourage you, if you think you might be eligible and if you're interested, to contact them to participate in this trial. The other interesting, I think that there's another trial. If they're not enrolling now, they're just about to. And this trial really is using an experimental medication that kind of taps into another genetic mutation associated with a higher risk of Parkinson's disease, and that's leucine-rich repeat kinase 2. It's a protein that is involved in getting rid of damaged cell parts. So we know that there is a mutation that ramps up this LRRK2 and it decreases the clearance of some of these damaged cell parts. And so this new medication is actually associated with dampening down the LRRK2 protein. And so there are specific eligibility criteria for enrolling in this trial, and you would have to contact Hawaii Pacific Neuroscience. But it's another idea and another intervention that I think is kind of exciting and very promising. So.
All righty. Well, time goes by very, very quickly. Dr. Webb Ross, Dr. Michiko Bruno, thank you very much for being here. There's a lot of research going on. So I guess diet, exercise, just that, and along with the research and medications. Thank you. There's a lot of information there. Jerry, I'll turn it over to you.
All right, so I think the clock is striking. It's about time for us to wrap up. I have a few thank yous as we do this. Of course, first of all, I have to thank you, everybody that came who made this event a success. We had 205 people register. We were supposed to have about 175 people here today. That doesn't include all of our other folks. But you guys are why we put this on, and everybody showing up, both online and in person. Just a tremendous crowd, and we thank you so much. We hope you found it useful and beneficial, and we're always available for your follow-up. So that's the first group. The second group, of course, you can't put on an event like this without a lot of volunteers. I had a crew of about 30 volunteers, probably another 10 paid contractors for various things. So, I mean, we probably have about a quarter of everybody's just involved in putting on this in one way or the other. And I couldn't do it without all of them, and especially my wife who's hiding in the back. Her and Fran Adams did all the food and took care of you, so making sure everybody got plenty to eat and plenty to drink. And a little birdie told me that Fran Adams, for anybody that was here at St. Francis for the Christmas tree contest, the Hawaii Parkinson Association had a tree that had the 12 days of Jerry Christmas, Jerry referring to Jerry Korea. And if you want to read what they are, you got to come down to the Resource Center. They're pretty humorous and they're great. Besides that, I think that's most everybody. Because I think, like I said, I'm just so glad that you guys came. Hope everybody had a good time. With that, if there's anything we can do to help you out, please reach out to the Resource Center, and we'll be more than happy to try to help you. With that, thanks. Oh, I know I did forget one person. I forgot our glorious MC, Mr. Ben Gutierrez, who's the biggest thing I have to thank Ben for was no rain. We had the clouds so everybody could actually see the screen. We had no rain. It didn't make the day couldn't be any better than that. So thanks, Ben, for a great job. You don't hear that very often, do you? No. With that, I'll go ahead and wrap up and say aloha to everybody. Thank you very much for having been here. I couldn't forget.